Welcome to Planning for Government Retirement. Today's agenda will cover creating a plan, understanding your retirement benefit options, Medicare 101, and the benefits of combining your federal employee health benefits coverage with Medicare. It's never too early to start thinking about your retirement. In fact, the earlier you start planning, the better. Whether your retirement is 30 years or 30 days away, on behalf of the Blue Cross and Blue Shield Service Benefit Plan, we want to thank you for your years of federal service. Retirement is a good time to focus on doing the things you enjoy, such as developing a new or existing hobby, traveling, enjoying more time with family and friends, continuing your education, volunteering, and focusing on your health and well-being. Knowing how you want to spend your retirement can help you better plan for the future. No matter your age, remember to take care of yourself today, because staying up to date with your preventive care could help you later in life. Make sure to see your primary doctor at least once a year. Keep your blood pressure, cholesterol, blood sugar, and body mass index under control to help prevent heart attacks and strokes. Get any other recommended screenings and tests to help identify potential health problems early. And maintain healthy eating, exercise, and lifestyle habits. Let's talk about creating a plan. Here are 5 tips to start planning for retirement. 1. We recommend you start thinking about retirement at least 5 years in advance. We'll explain the 5-year rule later in this presentation. 2. Don't plan in a silo. If you're married or in a committed relationship, discuss your plans with your significant other. 3. Talking to friends is good. However, everyone's retirement needs and plans are different. Know your options. 4. Take an inventory of your financial assets. If you haven't talked to a financial planner, you may want to. 5. Evaluate your health needs and think about possible future needs. Keep your family's needs in mind too. Evaluating your health needs is key. You'll want to consider what matters most and keep in mind specific benefits and services. Ask yourself how important it is to have a large network of providers, to know that you're covered if you go out of town or travel overseas, that you have prescription drug coverage, that you're protected from a catastrophic medical event. Another really important thing to consider, the cost. How much are you willing to pay for your healthcare coverage? Let's get to know your retirement benefit options. One of the best things about being a federal government employee is that you can take many of your benefits into retirement with you. The Federal Employees Health Benefits Program, the Federal Employees Dental and Vision Insurance Program, the Federal Long-Term Care Insurance Program, and the Federal Employees Group Life Insurance Program can all carry into retirement. If you're currently enrolled in a flexible spending account, such as FSA Feds, you will not be able to take it into retirement. When deciding whether to keep your medical coverage, ask yourself these questions. Should I keep my government insurance when I retire, or should I look at different plans? What changes with my health insurance when I retire? What is Medicare, and how does it fit into my plans? We'll give you some tools to help answer these questions throughout this presentation. But ultimately, when it comes to your health and health insurance, the decisions are up to you. One thing to consider is keeping your Federal Employee Health Benefits, or FEHB coverage. As a federal employee, you have some of the best medical benefits of anyone living in the U.S. When you retire, you get the same benefits you get now as an actively working employee. Your premiums also do not go up because you retire. Take time to review your options. You'll still have the chance to review your options during the federal benefits open season, usually the second week of November through the second week of December of each year. You can also review them if you have a qualifying life event in which you would need to add or drop a dependent, such as a marriage or divorce. As long as you don't cancel your insurance, your coverage will never go away for as long as you're retired. Keep in mind that if you do choose to cancel your insurance, you will never be able to re-enroll in the FEHB. If you want to try a non-FEHB plan, such as TRICARE, suspend your coverage, don't cancel it. For information on suspending your FEHB enrollment, contact your retirement office. To keep your medical coverage, you must have 5 years of continuous enrollment in the FEHB before you retire. This is known as the 5-year rule. This rule only applies to FEHB coverage, not FEDVIP. Now let's take a closer look at your costs and premiums. The federal government will continue to pay a portion of your FEHB premium. They pay about 70% of the cost, and you pay the rest. You'll pay your premium monthly. It usually comes out of your annuity. After you retire, your payroll office becomes the U.S. Office of Personnel Management, or OPM. They'll handle any questions or changes in regard to your enrollment. If you die, your eligible surviving family members can keep your coverage. You must be enrolled in Self Plus One or Self and Family at the time of death for this to apply. Let's talk about Medicare. Medicare is a health insurance program provided by the U.S. government to individuals 65 and older, with certain disabilities, and people with end-stage renal disease. If you sign up for Medicare and are still actively working, your FEHB plan is usually your primary coverage, meaning it pays first. If you're retired, Medicare is usually your primary coverage. Medicare has 4 parts. Medicare Part A is hospital insurance. It covers inpatient, skilled nursing facility, home health, and hospice care. Most people don't pay a premium for Part A. Medicare Part B is medical insurance. It covers doctor's visits, outpatient services, x-rays and lab tests, durable medical equipment, preventive services, physical and occupational therapy, and other services not covered by Part A. The standard premium in 2019 for Part B is $135.50 per month. You may pay more or less depending on your income. Medicare Part C is a Medicare Advantage plan. This is private health insurance that helps to cover some of the things that Part A and B don't cover. Premiums for Part C vary by provider. Medicare Part D is prescription drug coverage. Prescription drug coverage is not included in Medicare Part A or B. Premiums for Part D vary by provider. You cannot enroll in Medicare until you become eligible. For most people, your initial eligibility period begins 3 months before your 65th birthday, and it ends 3 months after your 65th birthday. If you receive Social Security benefits at least 4 months before turning 65, you'll automatically be enrolled in Medicare Parts A and B. Your coverage will start on the first day of the month of your 65th birthday. You can opt out of Part B coverage if you want to. Simply follow the directions on your Medicare ID card. You'll receive this card the first 3 months before you turn 65. If you're not automatically enrolled and don't receive your card, you can contact your local Social Security office or visit ssa.gov. Remember that enrolling in Medicare is a choice. You're not required to sign up. But before you make a decision, you'll want to consider your future health needs. Even if you're in perfect health now, health needs tend to change as we age. And what happens if you don't sign up when you're first eligible? You can still sign up later. However, you may pay a late enrollment penalty if you don't enroll in Medicare Part B when you're first eligible. The penalty is a 10% premium increase for each year you delay enrollment. It's also important to note that the penalty doesn't apply if you or your spouse is still actively working during your initial enrollment period and you choose to keep your employer-sponsored health coverage. In this case, once you retire, you'll have 8 months to enroll in Medicare without penalty. You can also sign up at any time while you're still working. Both FEHB and Medicare provide great benefits. Choosing to combine them can offer you even greater benefits. While Medicare Part A and B cover a lot, there are some things they don't cover. These are called gaps. Some of the gaps include prescriptions, hearing aids, dental care, and overseas care. Your FEHB plan may cover these services. Combining coverage may reduce some out-of-pocket costs. Many FEHB plans waive or reduce deductibles and copays when Medicare is your primary coverage. For example, with Medicare Part A in 2019, there's a $1,364 deductible for inpatient care. If you combine coverage, your FEHB plan may pay that deductible for you. Combining coverage can also impact your premiums. Medicare Part A is free for most people. That's why most federal employees and retirees take it as soon as they're eligible. There is a premium for Medicare Part B. 2019's premium is $135.50 per month for most people. If you combine coverage, you'll pay the Medicare Part B premium and your FEHB plan's premium. If you calculate the cost of both premiums, the overall annual cost of both can be lower than your medical costs, especially as your health needs grow later in life. Some FEHB plans have benefits or programs that can help members pay their Part B premiums. Medicare Part A and B don't cover vision and dental care, but your FEHB plan may offer some coverage. If you need additional coverage beyond what your FEHB plan offers, enrolling in a FEHB dental or vision plan could be good for you. Similar to FEHB, FEHB dental and vision benefits don't change once you retire. You'll pay your premium monthly. What about Part C? It's private insurance not offered as part of FEHB. It's also known as Medicare Advantage or Medigap. These plans are offered by companies that contract with Medicare. They cover Part A and B services and can cover some additional services those two plans don't cover. You may need to pay for those additional services. You have different options for Part C plans, such as preferred provider organizations and health maintenance organizations. The premium you'll pay depends on the plan. The plans offered to you can vary based on where you live. If you keep your FEHB coverage, you don't need to sign up for Medicare Part C. If you're deciding between FEHB and Medicare Part C, you'll need to look at the benefits and costs of each to see which is right for you. And remember, if you cancel your FEHB coverage after you retire, you can never re-enter the program. Now what about Part D? It's private prescription drug coverage. You'll pay a separate premium for this coverage. Medicare Part A and B do not cover prescription drugs. If you have those plans alone, you'll pay the full cost of your prescriptions when you go to the pharmacy. On average, your FEHB coverage pays out the same amount as a Part D plan. If you keep your FEHB coverage and combine it with Medicare Part A and B, you don't need to enroll in a supplemental drug plan, such as Medicare Part D. If you don't keep your FEHB coverage, you'll need to enroll in a plan that covers prescriptions, such as Part D. Similar to Part B, there may be a penalty if you don't sign up for Part D when you're first eligible and decide you want it later. The penalty is 1% for each month you don't have coverage. This penalty does not apply if you're covered in another plan that offers equivalent coverage. If you ever lose your equivalent coverage, you'll have 63 days to enroll in a Part D plan before the penalty kicks in. Some final thoughts while planning for your retirement. The best way to decide whether to combine or not combine coverage is to determine what your needs are today and what you think they may be in the future. Then you can make a decision based on those needs. You want to make sure your choice gives you peace of mind. Make sure to do your research. If you want to know how your current FEHB plan combines with Medicare, reach out to them. If you're a Blue Cross and Blue Shield Service Benefit Plan member, visit fepblue.org/Medicare or call the customer service number on the back of your member ID card. Ask your current health plan about how they cover Medicare gaps, whether or not they waive out-of-pocket costs if you combine your coverage, and if there are any special benefits or incentives for members who have Medicare coverage. If you have any additional questions, you can reach out directly to these organizations. Don't forget to follow us on Facebook, Twitter, Instagram, YouTube, LinkedIn, and Pinterest for more healthy tips and benefits information. You can also sign up for Blue News, our monthly email newsletter. Thank you, and good luck with your retirement planning.